hospice was a savior for the family from the moment that they came onto the scene. They were of such tremendous help.
We do serve 280 patients approximately each year in the Lodi and surrounding areas, but we feel that that population is vastly underserved.
Even a short drive to Stockton sometimes is an awful long drive for someone, for a family that's going through that. So it would be a blessing to so many to have it close in Lodi.
For years, Hospice of San Joaquin has been known as the Stockton company that's doing business in and pick any other community.
Providing compassionate services locally since 1980, Hospice of San Joaquin will now expand its presence in Lodi. The building to house the Hospice of San Joaquin Center is donated by the Stokes family, fourth-generation Lodians.
It's a community that likes to take care of their own, and all the funds raised will stay in the Lodi community. Death is a normal part of life, and there may be a point in time that you or a loved one will need the services of Hospice of San Joaquin. It's a valuable resource for the people who live here.
We partner with the families, and that's an important concept in hospice. The vast majority of our patients are seen in the home, and the primary caregivers are the family. What we provide is the expertise in what to expect, along with the clinical expertise associated with our nursing, physician, social service, our chaplains, all of whom have special training in end-of-life care. Hospice of San Joaquin provides services that go well beyond that required by Medicare for hospice care. We provide a great deal of additional bereavement support. We have a transitions program, and we have a large education program, both in terms of community education and professional education for other healthcare providers.
I watch my wife and her siblings struggling with the day-to-day downturn of my mother-in-law, and it was an emotional time for the entire family. I'm kind of a take charge type person, and for me it was difficult to stand back in the wings and watch them with the ups and downs of the daily wanting to care and give her the compassion that she wanted to have by staying at home. And finally a friend said, you know, why don't you give hospice a call? And from that point on, then every week they had somebody out 3 times a week, and they gave my wife and her sister instructions on how to deal with the end stage of life situations that they were dealing with. And they would give Marie bathing and massages, and the care that the individuals were giving Marie was as if they were their own family member. It was with love. You could tell that they had the compassion for the person that they were dealing with.
They're just there. They are absolutely wonderful and very caring, very helpful, and they just kind of take you under their wings and help you through the whole process.
Bereavement or grief support is offered following the death of a loved one. Services include seasonal workshops and support groups for children and adults.
It's so easy to sit in the sad part. And by going to the bereavement program, we found that there's a lot of joy in the memories, not sadness. It helps you grow, helps you understand life.
Transitions is available for pre-hospice patients who are in treatment such as chemotherapy, radiation, and dialysis.
Gives them some feelings of control and of choice. So they're not alone. They can have someone to call and know that that person is there for them all of the time, you know, on the other end of the line.
The joys that I get is I read all the mail, and the cards and letters that we get saying, "You've made this so much easier for us." Without Hospice of San Joaquin, I don't know if we would have been able to provide the care necessary for our mother, our daughter, our son, our husband, wife, whatever. We get those cards every day.
Hospice of San Joaquin needs your help to build out the Regional Care Center in Lodi and to continue supporting the growing needs of this community.
It is a service that is of such great importance to the family that it cannot be measured in time or money.
You want to kind of be in that cocoon of your safe spot and your home, your hometown, your own community is where that is.
Business owners in the community have a real opportunity here to be part of this. It's going to take money to make this happen, and then that's really what we're looking for in this campaign. We feel that this is an attainable goal, and we also feel that it's an exciting goal. A community is only as good as those folks that put back into it.